דוקטור מת'יו האריס, שלום אדוני, בוקר טוב, תודה שאתה מצטרף אלינו מארצות הברית.
היי.
דוקטור האריס, אנחנו רוצים לדבר איתך על ילדים שמאושפזים עכשיו בבתי החולים בארצות הברית. מה קורה עם זה?
Thanks for having me. One of the graces of the early portion of the pandemic was that it seemed that children were largely spared from serious disease, perhaps with the exception of those who had underlying medical problems that put them at higher risk for infection. What we have seen in recent weeks, more so in parts of the country that are under-vaccinated, is a significant increase not only in the rate of infection, but of the rate of hospitalization and serious illness in children. There have been several reports out of Texas and other states in the South where pediatric ICU beds have been occupied, some by COVID-positive patients who are very sick, but also by other viral respiratory patients. But we are certainly seeing a concerning increase in the number of hospitalized and ill children.
מה אתה יכול לספר לנו על הסימפטומים של הילדים האלה? על אילו גילאים אנחנו מדברים גם?
So I think what is somewhat worrisome is that the age group has been very variable. There have been several reports of several young infants and school-age children admitted with COVID-like pneumonia. We should keep in mind that relative to adults, these numbers are still relatively small, 0.01% of the pediatric population, dies from coronavirus, with the exception of those with prior illnesses. So the age has been somewhat variable, but we are seeing in a concerning fashion more adult-like pneumonia, especially in our adolescent patients.
דוקטור האריס, אתה יכול לספר לנו משהו על הרקע שלהם, על הרקע הרפואי? היה דיווח על כך שילדים שסובלים מעודף משקל קיצוני נוטים יותר לאשפוזים?
So I think that's true. There are certain medical conditions that put children at risk for severe COVID infection. Obesity is one of them, but perhaps more so those kids with chronic congenital heart disease, with asthma, with immunodeficiency, which is one of the reasons why the recent program to improve a third dose of the COVID vaccine, mRNA vaccines for these immunocompromised children is especially important.
ואנחנו מדברים עכשיו על ילדים מתחת לגיל 8?
So to be clear, the vaccine program would be for children 12 and older, which is what Pfizer is approved for in the United States. With regards to those being hospitalized, there is a spectrum of children, from infants to adolescents.
דוקטור האריס, היית אומר שיש עוד וריאנט שמכה בארצות הברית שאתם אולי לא מכירים אותו, או שזה משהו אחר?
Sure. One of the challenges in the United States is that surveillance for the different variants is limited, mostly to state and federal governments. So we know that Delta virus accounts for about 80% of new infections here in New York and around the country. We do worry about the emergence of Gamma and Lambda, but I don't believe they yet represent a significant number of infections. But we saw that with the Delta variant, it went from representing 10% in the beginning of 1 month to 80%, 3 to 4 weeks later. So that is the worry.
כן, ישראל נמצאת עכשיו בעיצומו של מבצע חיסונים שלישי ברחבי המדינה כולה, והולך לא רע, צריך לומר. עכשיו, גם ה-FDA הודיע שהוא תומך בחיסון השלישי הזה, והוא נחשב לבטוח. אתה רואה את האמריקאים רצים להתחסן בחיסון שלישי?
I hope so. I think there has been a fair amount of fatigue with vaccine, and there is a very worrisome level of skepticism against vaccination in the United States. But what we know is that there are several studies, including significant data out of Israel, that the efficacy of the vaccine, even in healthy people, can wane significantly, as low as 42% out of the Israeli data, a number of months after vaccination. If that's true, and combined with the concern for the virulence of the Delta virus, I think we have no choice but to roll up our sleeves and get that third dose, that booster dose, sometime around 8 months after the primary vaccination series.
דוקטור האריס, תרשה לי לשאול אותך שאלה נוספת על הילדים. אחוז התמותה עלה בקרב הילדים?
So as reporting for this morning from I believe it's from the CDC, nationwide we know about 382 children have died from COVID. That is still, thankfully, an extraordinarily small percentage of all deaths for all comers, but also deaths from pediatric cases. The concern is that a slight variation in any of these mutants and any of these variants could cause the disease to be much more significant in children. Again, we were very, in some respects, lucky that this virus did not act like traditional viruses, infecting the young and the old equally. So I worry that that number might change. Right now, the number has been relatively steady and relatively low, but that could change, in a heartbeat.
דוקטור מת'יו האריס, בארצות הברית, תודה רבה לך שדיברת איתנו, תודה.
Thanks for having me.